Hi, everyone. I'm Kat McAlpine. I'm the editor of Boston University's research news site, and I am here today with Dr. Zaia, who is the director of Occupational Health Services here at BU. She is taking care of faculty and staff, and I'm also here with Dr. Judy Platt, who is our director of Student Health Services, and she is taking care of our student community. We're here talking today about the coronavirus, COVID-19 infection and how it's impacting our community, the steps students can take to protect themselves, and what you can do if you or someone you know has tested positive for COVID-19. So kick it right off. We got a big question to start with, which is, since we're all hopefully practicing social distancing and staying at home, Doctors Platt and Zaia, what do you recommend if someone, potentially you, but someone in your home, or residence, or dormitory begins to show symptoms?
Kat, I appreciate that you led off that question with, since we're all hopefully practicing social distancing. I think to say social distancing is one thing, and to sort of, walk into a room and not hug someone or embrace them seems probably obvious, but really social distancing, in an ideal world, if you could do this, you'd keep yourself beyond 6 feet away, because a close contact is defined as someone who's within 6 feet for at least 15 minutes. And that plays a role as we talk about, what do I do if I find out that I've been exposed to someone? So for social distancing, I think really being thoughtful about all of your interactions. Think about your typical day. Maybe you're not going to class, obviously, if you're virtually attending classes, or maybe you're not going out as much as you usually do, but perhaps there's a pocket or a group that you're still in close communication with in person. So I think that's really important, just to go back to keeping yourself socially distant is really important, because then when you get the news that someone's a close contact, or if you start having symptoms yourself, you don't have to worry about, oh my goodness, yesterday I was just having that big dinner party with 10 people, which sounds like maybe people aren't doing that anymore, but it does still happen.
Now, practically speaking, since, many people, some of our students, whether they're off campus or they've returned to their permanent homes, as the majority of them have, we do know there are still some students with special circumstances who are, remaining on campus. When you're sharing your spaces with other people, what are some ways to social distance in your own residence, in your own building?
Well, that can be a little bit difficult sometimes, Kat. We're asking people to do the best that they can. People do live in small apartments, small homes. The residents on campus may be small rooms. But the best thing you can do is try to distance yourself, as Dr. Platt was mentioning, at least 6 feet apart. So if your seating area is typically closed because we like to sit next to each other or watching television or maybe playing video games, separate those chairs. You also want to think about what your habits are in common areas. So if you only have one bathroom in the apartment or the house, you want to make sure when one person uses it, they wipe it down with a disinfectant. Same thing with your kitchen area. And important are the high touch areas, the doorknobs, the handle on the refrigerator, the microwave, things that we don't typically think about doing every day.
Now, since there are kind of a shortage of supplies right now, and some of these cleaning supplies, how can you disinfect? Do you really need to have all the Lysol, the hand sanitizer, or what are some ways people can get scrappy to disinfect surfaces with what they have on hand?
Well, certainly the disinfectants are the best. That's the modern way to do it. But remember, in the old days, we used to do disinfection with soap and water. And actually the physical scrubbing of an area actually disrupts the virus. So if you don't have those products, don't give up. There are still things that you can do, which is the general clean that you would normally do with good old fashioned soap and water. If you're using a sponge, dedicate that sponge simply for that purpose. Wash the sponges, throw it in the washing machine, and actually wash it with hot water, because sponges can trap bacteria and other material, organic material as well.
Great. Now, obviously, all these steps are all about prevention, but we're sort of at a point now where here in Boston, it's likely that people will eventually know someone who has tested positive for COVID-19 and, in fact, may eventually test positive for COVID-19 themselves. So at this point, if someone starts feeling unwell, should they automatically assume it's coronavirus until it's been proven otherwise?
So, Kat, I think a lot of people have already been doing that anyway, but certainly remember that we are still in cold and flu season, and now we're starting up with allergy season. So some of the symptoms can be similar. I think if a student or if faculty or staff are having questions and they're not sure and trying to figure out what their symptoms might be, calling or Zooming in with a healthcare provider can be a really helpful way to talk through your symptoms and determine what might be going on. So sometimes it's not obvious. The classical symptoms that have been talked about for COVID-19 for some time have been fever, cough, and shortness of breath. But certainly, as we've seen more people become diagnosed with COVID-19 or be tested for COVID-19, sometimes those symptoms may mimic other similar colds and viruses that are going on now. So when you say, should we assume it's COVID-19? I don't think we should necessarily assume it's COVID-19, but I think we should practice isolation just like we would if we're ill any time of the year. So if you think you have the flu, it's a good idea not to go out in that group activity. It's a good idea to make sure you've got tissues, sore throat lozenges, ibuprofen or Tylenol on hand so that you can treat and take care of yourself. So I think when you're sick, it's good to isolate yourself anyway. We're making a big deal about it now because of COVID, but these are good practices that we've always recommended.
That's great. Now, I just want to just give a quick refresh for anyone that has joined us in the last few minutes. I'm here with doctors Zaia and Judy Platt of BU's Occupational Health Services and Student Health Services. We're talking about COVID-19, how students can prepare for this, and what you can do if you or someone you know has COVID symptoms or has tested positive. Now, we were just talking about some of the things we can do if someone starts to feel unwell. Is it recommended at this point to seek testing for COVID-19, even if you are experiencing mild symptoms that may share a lot in common with cold and flu?
That's a really good question, Kat. And actually, a lot of people have been asking that recently, especially with what's in the media currently. The Massachusetts Department of Public Health just came out with last week with 8 new categories of testing. Prior to that, we were extremely limited as to who we could actually test. Number 1 on that category, of course, are healthcare workers with symptoms. They want to get those folks tested very quickly. And so access to that testing is more available for healthcare workers, but it falls all the way down to 8 categories. And the 8th category is somebody that may be over the age of 55, 60 with certain comorbidities. They're also symptomatic. Now, previously, we couldn't get those people tested. So there are those 8 categories. They are online. So I would certainly encourage people, if they're symptomatic and they have any pre-existing health conditions, even for younger folks, if you have asthma, autoimmune disease, and you're feeling unwell, to talk to your healthcare provider and ask them if you might fit into one of those new categories to provide testing for you.
Great. Now, we do know that the majority of students at Boston University have left campus and returned to their permanent homes. However, because of special circumstances, there are still some students on campus. So I'm going to break this question into 2 parts. One for anyone that may still be on the BU campus, and then we can talk a little broader about the Boston area. But for folks who are still on campus, how and where would they seek testing if they did have symptoms that they feared may be indicative of COVID-19?
So I think one thing to keep in mind, and this is true whether you're a student, faculty, or staff here on campus, or if you're currently remotely doing work and you're off campus, when you start having symptoms, or if you find out that someone who is a close contact of yours has been diagnosed, you don't need to get tested right away. In fact, people who are not having symptoms is probably the easiest group to say there's no recommendation for testing right now. So the first part for testing is you need to be at least having symptoms. And then as Dr. Zaia mentioned, you also need to fall into some categories that will prioritize testing for you. So if you develop symptoms, I think the most important thing is to reach out to a healthcare provider. We can help direct you to where testing is. I can tell you specifically on BU's campus, we're referring most students to Boston Medical Center. They are doing testing, as are most of the hospitals, in tents outside of the hospital. The goal is not to have people go into the emergency room, but certainly if a healthcare provider calls first, that's going to help to prioritize testing and not have a student or an employee show up somewhere and be turned away for testing. So the first thing is really to talk to someone to determine, do your symptoms warrant being warrant is maybe not the best word, but are your symptoms consistent with COVID-19, and therefore a recommendation for testing would be made, and let healthcare providers figure that piece out. Now, what do you do if it's 1 a.m. and you start having symptoms? You don't necessarily need to call a healthcare provider. The first piece of advice is really to isolate yourself as much as possible and then call a healthcare provider. We're probably not going to have 24/7 testing going on for quite some time. And again, it's not imperative to be tested. It's imperative to isolate yourself as much as possible so that you avoid infecting others.
Now we're starting to get some really good questions from viewers. So I would remind everyone that you can submit a question in the comment section of this video. We were just talking about, you were just talking about symptoms that would trigger a healthcare provider to suggest that someone seek testing at, potentially Boston Medical Center if they were coming from the BU campus. Now there is a little bit confusion about what the key symptoms are that healthcares are looking for that would indicate COVID-19. Can you give us a little bit more clarity? I know we've been thinking about fever and cough. There are reports starting to come out that, there could be other symptoms, or that the fever might be not there. Can you give us a little clarity on what are sort of the hinge points that clinicians are looking for when they say this is someone that needs to get tested?
That's a really good question, Kat. And it's fascinating for us in the medical field because this is a very rapidly evolving situation in terms of symptoms. In the very beginning, all we were concerned about, or all we were advised to be concerned about, and I think this is what everybody had heard in the popular press, was the fever over 100.4, cough, and shortness of breath. Those, in fact, are still symptoms that we watch for very carefully because those are symptoms of the more serious form of the disease, the lower respiratory portion of the disease, which we hope that most people don't get. However, what we've come to find out about COVID since we've been tracking this is there's a variety of other symptoms, including very mild symptoms. So people can feel like they have a cold. So things like nasal congestion, mild cough, even a dry cough, low-grade fevers as opposed to the 100.4 or over that we get concerned about. Gastric symptoms, which we never realized were associated with this until very recently, including nausea, vomiting, and diarrhea. Some cases are actually only presenting with diarrhea, especially in the younger population. So that's something to be alert for. So essentially, anything that somebody's calling us and telling us they're having, we have to do a much deeper dive in terms of talking to them about their general health history, medications they're on, and doing a really good symptom review to find out if, in fact, these are, as Dr. Platt pointed out earlier, simply seasonal allergies that we might recommend an antihistamine for, versus are these the early signs of COVID?
Now, if someone has contacted a healthcare provider or in consultation with Occupational Health Services or Student Health Services decides that the right move is to seek testing at one of the testing locations, is there any benefit to that person wearing a mask or wearing other protective gear to sort of contain any cough or respiratory fluids as they sort of go to a potentially populated area to seek testing?
So as we all probably are aware, or many of us are aware, masks have come under short supply. And a lot of that has to do with members of the general public who were not sick wearing masks earlier, thinking that that might be something that is protective. And the CDC has maintained that the general public does not need to wear masks. But I think you raise an important point, Kat, which is if I'm having symptoms, if I have a cough, if I have a sore throat, if I have a respiratory infection, and I'm coming in to seek care, then yes, ideally you'd have a mask, or you'd be doing your best to cover your cough, have a tissue, even a bandana or a handkerchief. Anything can help just to decrease the amount of viral particles that are in the air. Certainly it becomes, so that's not the general public if you're feeling well, but if you're sick, that's something that we've advised in previous cold and flu seasons as well. Cover your cough and your sneeze if you're able to.
Okay, so even something like a scarf or another sort of face covering. And then what about gloves? I've actually seen some stories of people saying that they went to seek help and they put on their winter gloves. Is there anything beneficial about taking that route?
Well, again, to Dr. Platt's point, protection is great. The gloves in general, remember the gloves are just simply an extension of your hand versus the face mask, which you shouldn't be touching. The gloves become your hand at that point. So anything you've touched with that glove hand and then you retouch is going to become contaminated potentially. So essentially, the best thing to do, as opposed to wearing gloves into a healthcare environment, would be to use the hand washing techniques that we've discussed repeatedly. They've heard in the popular press, the 20 seconds saying happy birthday. Some other people have been creative and put different size to that, but it really is the 20 seconds. And again, the friction, using regular soap and water is fine if you don't have antibacterial soap, but really the friction and the 20 seconds is the key.
Great. Now I am just going to give a refresh for anyone who's joined us in the last few minutes. I'm here with Dr. Zaia and Dr. Judy Platt of BU Occupational Health Services and BU Student Health Services. We are getting some really good questions from our viewers, so I'm going to turn to a couple of those for the doctors. We have a question from Kristen. She's asking about ibuprofen and the idea that ibuprofen may actually worsen COVID symptoms. So do you recommend taking ibuprofen for fever if a high fever presents itself?
The medical community is actually looking into that. As I said, this is a very rapidly evolving situation, and oftentimes we practice from what's called evidence-based medicine, and that often takes years to develop that evidence through research efforts, and then we begin practicing based on those findings of the research efforts. So in this very short period of time, there's been some evidence that perhaps using Motrin, and we're not sure why, may be problematic, but there's been other reports that it's not. So again, the medical community has not made a defined recommendation on that. So in light of that, probably the best thing to do is if you can take acetaminophen, paracetamol, Tylenol, which are essentially all the same over-the-counter medications for relieving fever, and they do relieve pain. The difference is Motrin is an anti-inflammatory, and there's suspicion as to that may be why it could be problematic, although again, we don't know that to be true yet. It acts a little bit differently than Tylenol does. But essentially, the recommendation currently is to use Tylenol if you have fever or pain. Now remember, the most important thing where you're taking Tylenol in any dosage strength is not to drink alcohol with the Tylenol. That's an extremely important recommendation. Absolutely no alcohol intake with any Tylenol use.
Thank you. A couple more great questions coming in from viewers. From Carol. Carol wants to know how to care for a family member or a roommate who is at home recovering from COVID-19.
We always encourage students when they're going through orientation to look out for one another. So I really appreciate that question. It's true for our whole community. This is a time where we want to help each other and look out for one another, yet it can feel very scary at the same time. So I think to have a full list on how to actually provide home care for someone who has been diagnosed with COVID, the CDC does a really nice job of this, and they'll kind of talk you through step by step. But if you're going to be caring for someone, in all likelihood, you might be within that 6-foot distance, making you a close contact. However, there are some ways that you can really think about how can I provide care for someone and maintain some distance. So I think thinking about that first can be very helpful. Setting up your household or your dorm room with things that you will need ahead of time can also help someone not need to get close to deliver those things to you. So if you have a little, medical stash bag with a thermometer, with tissues, with hand soap or hand sanitizer, with Tylenol, with sore throat lozenges, that's all really helpful, because instead of someone having to come close to you, they can just kind of put the box there in front of you. And a lot of times just being there, even if you're 6 feet away, asking someone if they need something and if you can bring it to them, and then distancing yourself a little bit when they pick up whatever you've dropped off, can be really helpful. So you don't have to be there, with a towel, putting it on someone's head, but you can certainly drop that towel off, be close to them enough so that they can reach it, and then remove yourself. The close contact is really within 6 feet for 15 minutes. So if you're having very brief interactions, that will help limit the chance of you also getting unwell if you're taking care of someone with COVID. Dr. Zaia, I'm interested in any other tricks that you would have as well.
No, I think those are great suggestions, Dr. Platt. I love the box idea. I think that's a great student health technique. And I think we could carry that over to the faculty and staff and have people create emergency kits and put those products in a box or a plastic container that can be disinfected, or perhaps a box that can be disposed of later, and make it the sick box and keep it in a central location in the home where people know to access it. So it is there ready, because there are very few 24-hour pharmacies anymore. And if you need something at 2 o'clock in the morning, it's going to be very difficult to get. So I think that's a great suggestion.
That's great. Thank you, Dr. Zaia. Now on that topic of, making an essential run to potentially get some supplies from a pharmacy or, get some food at the grocery store, how can people stay safe as they're navigating these limited number of spaces that are still open to the public? But, what are some precautions people can take if they need to make one of those runs?
I love that you asked that question, Kat, because that is probably one of the most important things that we need to remember right now. People still do need to go out and get food. They need to go to the pharmacy for supplies. So, we've been saying all along, self-quarantine, stay in your home, the stay-at-home order by Governor Baker. So those are all important, but we do have to still live life to some degree, and we do need to get sustenance. So when you're going out to the grocery store, many of the grocery stores still have the wipes available. So absolutely wipe the carriages off, the shopping carts, and then dispose of those wipes. When you're touching products, remember those products have been touched probably by multiple other people. So the key thing to remember and to keep in your present consciousness the entire time you're at the grocery store or at the pharmacy is to remember, do not touch your face, your eyes, any of your mucous membranes, your eyes, your nose, your mouth. That's how you're going to transmit this virus into your body. And as soon as you get home or someplace that you can sanitize your hands, either through soap and water, or if you're carrying hand sanitizer with you, please be sure to do that. And remember, when you're putting the groceries into your refrigerator, you need to then wipe the refrigerator down after you've done that, because you've touched products that have been in a grocery store that may have been touched by other people.
That's great. And that was a great question from our viewer, Melissa. Another related question is from Sage. She's wondering, how long does the coronavirus live on surfaces? There have been some sort of differing reports based on laboratory studies, which of course have control settings that may not replicate what we might find outside of our own neighborhoods here. But she's wondering, she knows going outside is good for some fresh air, but should she worry about going to parks and specifically, having any interaction with playground equipment?
That's a really good question. And I know some of the public parks in Brookline have actually been closed just around the Boston area. But I think the question about how long the virus lasts on surfaces is something that we'll still continue to see evidence come out on. And as you mentioned, Kat, if you're in a perfect environment and it's stainless steel and it may last longer than it would on cardboard or some other product. But I think going back to what Dr. Zaia said, which is if there is something on a product or if there's something that you're touching, if you can wipe the surface down, great, because then the concerns are less. So if you're concerned that someone's used the bathroom and they may have been sick, if you can use a disinfecting wipe to wipe down the commonly touched areas, then you don't have to worry so much about, has it been 24 hours since someone last came in here? You can wipe the surface down. Standard cleaning products work. In terms of why it's so important if there is virus on surfaces, that's because we touch surfaces, and then, as Dr. Zaia mentioned, we touch our eyes, nose, and mouth. So I think focusing more on the good hand hygiene and avoiding touching your face will help, is a good prevention tip, so that no matter what comes out in a week or two about how long the virus lasts on surfaces, you're protected.
Thank you. Thank you very much, Dr. Platt. Now, we have another question from Zaia this time. How can you reach your physician at Boston University if you are already out of state?
Great question. So we are seeing students via telemedicine and telehealth here at Boston University Student Health Services. And even if there's not someone live to do a telehealth visit with, our number works 24/7. There are always healthcare providers on call to answer questions. One of the easiest ways that we found that I think many students prefer to ask us questions is through Patient Connect, which is the online portal. For students who forget what that is where you uploaded all your incoming health forms. So Patient Connect is really the easiest and fastest way to get an answer from a healthcare provider. And if for some reason you don't have a computer at your fingertips, or you aren't able to get it on through your phone, then you can just call the main number for Student Health Services. That's on the back of everyone's Terrier cards. There's always someone to talk you through the next steps if you have a concern or an emergency.
Great. Now, kind of related to that question, if students have returned to their permanent home and then they test positive for coronavirus there, do they still need to contact Student Health Services at BU to let your office know?
So we are asking all students, as in the same vein that Dr. Zaia and Occupational Health are asking all faculty and staff to please contact us. And there are a few reasons for that. Even if you're getting healthcare from a primary care provider in your home state, it's important for us to know so that we can have a sense of what's going on in our community. But we are also starting to do contact tracing. And contact tracing is really determining who else you've come into contact with during the time when you could have been infectious. And so while that relies on the individual who may have been diagnosed, if you're a student and you just left campus a few days ago and you start developing symptoms, if you let us know, we can arrange for proper quarantine or isolation housing for students who may still be on campus, who need to be protected and need to protect our community. So it's really helping us to, one, know what's going on, two, be able to keep the rest of the community safe, and three, we'll check in with you daily. So if you have questions that might come up that maybe aren't related to healthcare questions just for COVID, maybe it's, I'm having a really hard time studying, I need a letter for a professor, we can help with that too. So I think having us looped in can really be beneficial, and many students have done this, and so we really appreciate your cooperation.
Now, this next question is going to be a two-part question, and one part of this question is coming from our viewer, Suvina. So if someone is diagnosed with COVID-19 and they were to enter the 14-day self-isolation period, can you talk a little bit about how self-quarantining is different from the social distancing, which we're doing now? And then the follow-up to that question is, if someone has been diagnosed with COVID-19, at what point will they know that they are well again?
So once somebody's been diagnosed, they do go into isolation. So there's two different terms. Isolation is knowing that you're positive, you've been tested, and you're isolating from other people. Self-quarantine is you've either been in contact with somebody that is positive, or we've made a recommendation because perhaps you've traveled from a country, and now we're looking at other areas in the United States that you're traveling from, coming back into Massachusetts, for example, that we may ask you to self-quarantine. They're not essentially different except based on the diagnosis. So self-quarantine is you haven't been diagnosed with it yet, but you've been in contact with somebody who has. Self-isolation is you have it. So the measures are actually identical, that you're going to stay in the home, you're going to practice the social distancing, you're going to pay very close attention to hand hygiene and hygiene in general, and try not to come in contact with others within 6 feet for more than 15 minutes if they need to assist you with anything. And it's still going to be a 14-day period either way.
Now, at what point during that period, what are some high risk symptoms that people who are taking care of themselves at home, what should they be looking out for in terms of seeking medical help? What would lead to something that would require hospitalization?
So I think one of the main reasons that people have needed to seek a higher level of care, either through an emergency room or hospitalization, has to do with difficulty breathing. So as we've discussed, shortness of breath can be a symptom of this illness. And for some, that becomes very severe. So if you're the patient yourself, or if you're caring for someone and you're noticing that it's looking it seems as if they're having a lot of trouble breathing, that's a reason to immediately get medical attention. It doesn't mean that you show up at the emergency room unannounced if you can help it, trying to alert someone, calling 911 if you're off campus, calling BUPD if you're on campus here. But a life-threatening emergency, someone's having difficulty breathing or talking, those are reasons to get help immediately. I think the two most common reasons that we've seen students reaching out for more urgent help has to do with difficulty breathing and with fevers that don't seem to be coming down. So you've tried the appropriate dose of Tylenol or ibuprofen, and you're not getting relief with that. And sometimes that may just be a problem of not taking enough. So that's a good first call to a healthcare provider. But if someone looks to be in distress and is not able to breathe, that's a reason to get to care immediately.
Now, there's a related question from our viewer, Armin, and he wanted to know what dosage of Tylenol is recommended to control a fever. And I would expand that to beyond Tylenol. What are some of the dosage recommendations for the Tylenols, the Advils that you would take or recommend?
That's something you should discuss directly with your healthcare provider. There may actually be reasons you shouldn't be taking Tylenol. People with pre-existing liver disease, other disorders. So you should be in conversation with your healthcare provider and do it before you get sick so you know what to do. There are over-the-counter doses of Tylenol, as you probably know. Those dosages in the probably last 10 years have actually been reduced for the over-the-counter recommendations because of situations involving people taking too much. So even over-the-counter medications are not as benign as people think. You have to follow the package directions very specifically. And for most adults, there is a standard dose, but I would highly encourage folks to have a discussion with your healthcare provider, especially if you're on other medications. Remember, you can have what's called drug-drug interactions, and there are some medications that you shouldn't take with other medications. So do have that conversation with your healthcare provider. For faculty and staff, we encourage you to call your primary care physicians. Student health encourages you to make a connection through the Patient Connect portal and have a discussion with one of their healthcare providers and just get some advice before you get into a situation at 2 o'clock in the morning where you don't know who to ask.
Thank you, Dr. Zaia. Another great question. This one's coming from Eli. If someone has already had COVID-19, but they are no longer symptomatic, can they still pass COVID-19 to other people? And I want to add a follow-on question to that, which is there any assumption that someone who has had COVID-19 and recovered has developed any immunity to the virus?
So in terms of when do you know that you're safe and you'll no longer pass this on? So you've already been diagnosed. I think this is a great question because 2 weeks ago, we would have said with guidance from the CDC that if you were diagnosed with COVID-19 and you had to go into isolation because you were infected, the way that you would know you could come out of isolation was with another test that was negative. That no longer is the guidance being offered. So now the guidance is if you test positive with COVID-19 and you go into isolation and it has been at least 7 days since you first started having symptoms, as well as you've been fever-free for 3 days without the use of fever-reducing medicines, and you've had a significant improvement in your symptoms, then you can come back out to the community. It doesn't mean that your viral shedding is zero, but certainly the most likelihood of viral transmission is with people who are symptomatic. And so once those symptoms start to resolve, that decreases the chance of you getting someone else infected pretty significantly.
Thank you, Dr. Platt. Another great question. This one is from Michaela. Besides people who are immunocompromised already, do you know what is causing COVID to be more severe for some people who seem to start off with mild symptoms than others? And specifically, she wants to know, does it matter the number of times a person might encounter the virus if they were to, have a couple different touch points, perhaps at the grocery store? Is the number of exposures to the virus at play here at all?
Those are excellent questions. And I applaud the person who put that question in for asking that. There are researchers currently working on that information. We don't have full information on that currently. We don't know how much of the virus you have to be in contact with in order to actually transmit it. So we are still actually learning all of this information and working on it currently here at BU. So hopefully keep an eye out in the peer-reviewed literature, and the press has been done. BUR has done some great pieces on this, as well as BU Today, and keeping us up to date on that. So I would say look to those well-known peer-reviewed outlets to be looking for that information as it's coming forward, because certainly as medical providers, we're looking at the journals daily to see if that information is being put forth.
Thank you very much, Dr. Zaia. Now, just to refresh for anyone who's joined us in the last couple of minutes, I am here talking with Dr. Zaia and Dr. Judy Platt of Boston University's Occupational Health Services and Boston University's Student Health Services. I'm Kat McAlpine. I'm the editor of Boston University's research news site, The Brink. We have time for a couple more questions with Drs. Zaia and Platt. And one great question, this is a 30,000 foot view on what's going on, but do you have any insight for us on why the number of cases in the United States is much higher than some other populous countries around the world?
That's a really good question, and there's probably several answers to it. One thing that is really important is to think about how people are being tested. And so we mentioned a little earlier in the program that if you have symptoms, there are 8 criteria right now that the CDC are saying are the prioritized criteria that would get you tested. And I think early on, what we learned very early on with this virus, we learned that many people were not being tested or maybe even being diagnosed unless they had pneumonia or some other significant reason for hospitalization. So the more we test, the more we are going to find out. One thing that we had cautioned our community about is when you see the number of cases rising, it can feel really concerning. And you see the numbers rising every day. And that doesn't mean that more people are necessarily getting the virus. It means that we're testing it and we're diagnosing it more. So some of this is a matter of, as the testing continues to expand and roll out across all of the states, we're going to see more cases. That doesn't mean that that's a new case per se. That means that we are detecting a case or someone who already had it.
Thanks very much, Dr. Platt. That was a great answer to a great question from our viewer, Vikas. Now, for our last question here, I'm actually going to combine 2 questions from 2 different viewers. The first part of this question comes from Adele. How can we as students engage or contribute most effectively to the COVID-19 pandemic? And as an add-on to that question, there is a great question from our viewer, Grace, and she would like to know, what should we be specifically doing while social distancing? She's been going outside for a run here or there, doesn't see too many people, but she also knows friends who are having small get-togethers in their apartments. How can we be socially influencing our own networks to be participating in the correct behaviors right now?
So those are a lot of great questions. And I think one thing actually for all of us to do is acknowledge that this is really hard. Social distancing, being removed from your usual routine, is very difficult, and we're social by nature. So it's normal to want to get together, especially during a scary time where you'd like to have support. So I think thinking about ways that you can engage with one another where you're not actually sitting right next to someone can be really helpful. So, as opposed to texting, consider, using some other modality where you're actually having a conversation. I think that's really important. And a message was delivered to all students from the Wellbeing Project here at BU that is a compilation of departments working across BU to bring well-being to the forefront, because we know how important that is. But even those well-being resources are all things that are being done virtually. So I think first, acknowledge that this is hard. Second, acknowledge that there are other ways that you can engage with one another, and really think about ways to do that, because getting together in a small group, and I appreciate someone mentioning that, is something that we hear all the time. I can't tell you how many students I've spoken to who have said something like, I knew I was supposed to be in quarantine, but my friends had traveled outside the country as well, so we thought we'd all just get together. Or it was only 3 or 4 of us. And then, of course, 2 days later, someone gets a diagnosis and the rest of the group is saying, oh no, why did we have that small gathering? So I think in terms of what BU students can do, I think one is recognize that you are in the cohort that may not have those severe symptoms, but you could pass them on. And we all have loved ones or community members that we want to protect. So thinking about how you can proactively engage one another, be in contact, be in touch, recognize that it's hard, but really try to cut down on those small gatherings, because I can tell you, I've talked to so many people who are just, sort of like beating themselves up that they went out, even though they've been social distancing all week, and then they just went to this one event and now something has happened. So I think that's hard to do. In terms of influencing your social networks, there's nothing like being a good model. Modeling what to do can help your peers see, hey, this is a good idea, or acknowledging it's difficult and then saying, but we're not going to have this get together. We're all going to watch a movie together, but we're going to do it through this other venue, can be really helpful.
And I'd like to just add one piece to that and give credit to my colleague, Dr. Alan Rogers at BU Occupational Health, who suggested just this morning that one of the things that he does with his friends to still remain social and healthy is to get out in some fresh air, find a local park that is still open, and socially distance yourself from each other, meet your friends there out in the fresh air, bring your own mug of coffee and tea that you make at home, and talk. Just general discussion is healthy. It improves your mental health, it improves your outlook. But remember, in that environment, the open air environment, which is better than being sitting next to somebody on the couch, still maintain your social distancing, which is at least 6 feet. But that's a great offering that Dr. Rogers recommended to me, and I'm personally going to try that this weekend.
Thank you so much, Drs. Platt and Zaia. I like ending on that note. That gives me some ideas for how I can stay in touch safely with people that I care about as well. For anyone who did not have their questions answered during our session today, we will try to answer those and follow up with you after this broadcast. I also want to direct our viewers to a couple of really valuable general resources for the Boston University community. The first is the Boston University COVID-19 information website, which is bu.edu/COVID-19-information. That website has a ton of FAQ information, advice, and university advisories and news stories coming from BU Today, BU's daily news site, and The Brink, BU's research news site. So we're also pushing news out. Please visit us at bu.edu/brink and bu.edu/today to stay up to date with the latest coverage on not only what's happening in our community, but also what our community is doing to help address this COVID pandemic. So thank you so much to Dr. Platt and Dr. Zaia for all of your insight today. I'm feeling better. What a nice way to end a Friday.
Thank you, Kat.
Thank you for having us.